Great to meet all the nurses and the midwives I've seen this morning, the allied health professionals, I've seen those as well. Those specialising in breast care for breast cancer, which we know is a huge challenge for so many Australian women and families. To all of our doctors, including our foreign trained doctors, and I'll just say how much we welcome your contribution to the Australian Health Service. It's a terrific thing. I met also the dentist. Where is he? There he is, who took 30 seconds to give me a submission. That's what I call striking while the iron's hot. Well done. The reason I'm with Chris today here in Gladstone, and why I've been in Queensland all week, in Cairns, in Townsville, in Mackay, in Rockhampton, Gladstone, now I'm heading to Bundaberg as well, is simply to talk about health and hospitals. And that is why we need to fundamentally change the system for the future. What we're proposing a system which is funded nationally but run locally. Funded nationally with the Australian government being the dominant funders of the system for the first time, but run locally so that here in regional Queensland you can make more and more local decisions about the priorities you have here. One of the folk that I just met upstairs, whose little girl is in hospital with the insect bite, said from her perspective, and she's just north of here at Calliope I think, she said, look, for her the critical thing is being able to get to a GP out of hours so that we don't have to constantly traipse off to the accident emergency. And that is one of the reasons why we are so determined to fund GP super clinics across the country, working in partnership with the local colleges of general practice. But the whole idea is that when things happen outside of hours, that there is another place to go other than the accident emergency. A&E is absolutely essential, but it should be there to deal with the really serious cases. And so that's why we've got to get that balance right as well.